Hey y'all, my name is Rehner Sullivan. I am the Government Relations Director for the American Heart Association here in Mississippi. I'm really excited to talk to you today and share a little bit about what we're doing at Heart, specifically in advocacy. Um, this is new for me, this is weird. I would much rather be in person speaking to your class. I know this is a unusual time for everybody and we're all trying to figure it out. So have some grace and be patient with me as I try to navigate recording this video and sharing my screen so you can see my PowerPoint. So a little bit about me before we get started. I've been with Heart since December, so I'm brand new. I think I'm just a little over 4 months in. Prior to coming to the Heart Association, I worked as a policy associate for a nonprofit public interest law firm here in Jackson. I worked on public benefits issues, specifically looking at SNAP and TANF. Prior to that, I worked as one of the state directors for one of the 2 Navigator grants that's funded through the Affordable Care Act. So that job was primarily focused on making sure that people had access to healthcare. And so we did a lot of education and community organizing. And spent really about 5 years doing that kind of health access work in South Mississippi. I'm originally from Hattiesburg. I live in Clinton now with my husband and our 2 kids. He's actually in grad school at Mississippi College, so I'm real familiar with kind of what all you've been going through in a different kind of context, but we love Mississippi College and are really excited to be in Clinton and be a part of that community. But anyways, that's enough about me. I'm going to jump right into it. I'm going to share my screen, hopefully, so that you guys can see my PowerPoint. At the end of the PowerPoint, I'll share my email. I would love to answer any questions that you might have from the presentation about the work that we're doing. If there's something that you're really interested in or passionate about, I would love to connect with you on that issue. So please feel free to reach out to me about that. So I'm going to try to share my screen so y'all can see the PowerPoint. Thanks. All right, so hopefully this is working. So we'll start with who we are, the American Heart Association. I hope that you are familiar with this organization. We're over 100 years old. We're the oldest, I think, nonprofit working in heart health in the country. So our mission statement, move this over so you guys can see. Our mission statement has changed kind of recently. But it's to be a relentless force for a world of longer, healthier lives. And we'll talk a little bit more about why that change is so significant and why there's nothing, you notice that there's nothing about heart disease, stroke, cardiovascular health in our mission statement, but how this statement really encompasses all of the work that we do at Heart. So our advocacy mission is to influence and promote public policy that reduces the impact of cardiovascular disease and stroke. All right, so like I said, our mission statement, let me jump back actually, and let's look at this again before we move on. So like I said, our advocacy mission is to influence and promote public policy that reduces the impact of cardiovascular disease and stroke. We don't think at Heart that policy change is the solution to all of our problems, but we know it plays a major role in changing systems that directly impact community health. So a great example of this in my life, I mentioned prior to coming to AHA, I worked in healthcare access through program development and community organizing. I spent years working to make sure that eligible children and families had access to critical healthcare programs like the Children's Health Insurance Program, or CHIP, and Medicaid, many of whom were eligible but unenrolled. often I would have community members across South Mississippi call me and share that they desperately needed health care for themselves or a sick child. And more often than I care to admit, those families weren't eligible for any kind of health insurance in our state. And every time they were working families, they were families who had done everything that society said that they should do. Um, they were hardworking people. And there were people that deserved care. Everybody deserves care, right? But because of policy, they weren't eligible for health care in Mississippi. Not because our programming failed or wasn't working, or we weren't reaching people, not because there wasn't science involved, not because there wasn't this community impact piece, but because systems and policies that that create our healthcare system were limiting access. And that's really when I decided to transition my career into advocacy. I didn't want to give people temporary solutions to their very real problems, but rather fight to change the systems that created the problems in the first place. As we do this work in public health, without advocacy and without policy change, our solutions are often only temporary and they only impact certain segments of the population rather than helping everyone. And this is one of the things that drew me to the Heart Association. One of the things that I'm excited, or reasons why I'm excited to be here and to be working on these broader public health issues that really do affect ultimately cardiovascular health and stroke in our country and in our state. And the reasons why we are broadening our view of advocacy and our view of our work is because of this, so social determinants of health. So like I said, our mission statement for AHA doesn't specifically mention heart disease, right? We're the American Heart Disease, but our mission is to be a relentless force for a world of longer, healthier lives. And what is that really getting at? What it's really getting at is these social determinants of health. And I know and I hope that you're very familiar with what those things are. But this graph or this image on the slideshow is really, I like it. I think it really speaks to kind of the different spheres of our social existence that play a role and impact our health. And there's so many more than just what is listed on here. So as we work at AHA and as I do my work in advocacy, ultimately we have 10-year goals. So we were just closing out our 2020 goal and we've just started our 2030 goal. Our 2030 goals are to increase life expectancy by 2 years across the country. And so why would we be worried about life expectancy? Well, we're worried about life expectancy because we want people to have equitable access to healthy lives, and having equitable access to healthy lives, means that we're also simultaneously addressing heart disease, that we're simultaneously addressing stroke, we're addressing these chronic health conditions that we've been fighting so hard to reduce in our country. But to do that, we need strategies that integrate solutions addressing social determinants of health, solutions that impact the environments people live in, the social conditions in which they exist, and the state and federal policies and industry standards that impact their health. AHA is working through policy programming, community impact, science and research to create opportunities for all people of all races, economic statuses and situations, so that they can have, or so that we can help equitably change conditions so that those folks, all of us, can live healthy, successful lives. And this means changing the conversation about health outcomes in public health in Mississippi by looking at these systems through a lens of health equity and social determinants of health. So what are social determinants of health? From all of you, I hope that this is a repeat, but if it's new to you, I hope that you really take the time to consider as you move into your careers how social determinants of health affect and impact your clients and patients. Because it's not always as cut and dry and black and white as we would like to think it is, particularly in the South and in Mississippi. Social determinants of health are conditions in the places where people live, learn, work, and play that affect a wide range of health risks and outcomes. These conditions are known as social determinants of health. We know that poverty limits access to healthy food, safe neighborhoods, and that more education is a predictor of better health. We also know that differences in health are striking in communities with poor social determinants of health, such as unstable housing, low income, unsafe neighborhoods, and substandard education. By applying what we know about social determinants of health, we can not only improve individual and population health, but also advance health equity. And that's what we're trying to do at AHA. And so why does that matter? For advocacy. So why we advocate and why should you advocate? You are an expert, you're the constituent, our policymakers value your opinions, and you can shape the process. And I think as a relatively young person, that sounds like a lot of smoke, right? That, and I have this attitude sometimes, right, that policymakers, our lawmakers don't care what I think, they're just going to do what they want to do. I've detached myself at times from our political process. But the truth is, when I started this work, one of the best examples I have was last year working on SNAP issues in the legislature. So we were working to, and SNAP is a supplemental nutrition assistance program, so formerly known as food stamps. It's for working families who maybe don't make enough money to feed their families, and so it's exactly what it is. Says in its name, right? It's supplemental. It's not that much money. It just helps people get along. So we were working to lift a federal ban on SNAP and TANF for persons with felony drug convictions. So in Mississippi, you can have any type of felony, or prior to last year, you could have any type of felony except a drug felony and still receive SNAP benefits. And so this was this was a ban placed on states by the federal government during the war on drugs. But there is a provision that allows states to opt out of participating in that ban. And so at the time when we were looking at this, Mississippi was one of 3 states that still hadn't modified or opted out of this ban. So we approached one of our state senators, Sally Doty, who is who's great. She's wonderful. We work very closely together on lots of issues, but she is very friendly to public health issues. And we approached her to ask her about, what she thought about this SNAP TANF ban for persons with felony drug convictions, and ultimately wanted her to be a sponsor of a bill. And she ended up being a champion for passing this piece of legislation last session, which was great win for the state. But that first conversation that we had with her, she shared with us, as we approached her with this issue, that she had a constituent who had called her last year. She was a single mom who was trying to get back on her feet, who had suffered from addiction, and had gone to apply for TANF, which is Temporary Assistance for Needy Families. And TANF is a program that is a work-ready program. So it gives families a financial stipend while they're working on a GED or applying for jobs. It's literally exactly what it sounds like. It's temporary assistance, it's time limited, and there's all of these requirements for what you have to be doing to be seeking an employment or to be bettering yourself. And it comes with all sorts of resources, right? So this woman was trying to participate in this program, was trying to better her situation, but couldn't because she had a drug felony that was over, 10, 15 years old. And by all other standards had done everything she needed to do since then to really rehab her life. And that story, that one constituent story had stuck with Sally, and she remembered it. And when we brought up that issue, she said, this is something that matters to the people in my community. This is something that matters to my voters. And it's something that, I want to work on and champion. And because of that constituent story and because of that woman's experience, right? She was an expert on the issue. She was a voter. Her policymaker, her lawmaker valued her opinion, and that shaped the whole process of what we were able to do last session to lift the SNAP TANF drug felon ban in Mississippi. And so now that woman is able to apply and receive TANF and SNAP benefits for her family. So it's just an example of why it's important for you to be an advocate, why it's important for you to share your story and to believe that you're an expert in what you know. Your experiences are your experiences, and nobody can tell you any different. But your policymakers, they work for you, or they should, in theory. But if we don't demand that of them, I think they get lost a lot of times. And the more that we can interact, more that we can engage voters with our lawmakers, the better a chance that we have to really shape what is this political process, what is the policy process, what is the legislative process. So why advocate? Like I said, direct constituent interactions have more influence on lawmakers' decisions and other advocacy strategies. Your vote matters at the end of the day. They don't get where they are unless you vote for them. And elections are not won by huge margins, right? Like they're won by small votes, particularly in statewide elections, right? 500 votes is not very many people if you think about it in the grand scheme of things, right? From a community that could totally change an election, right? Like you probably know 500 people that didn't vote. The voters matter, what voters care about matters, and no lawmaker, no legislator wants bad press, right? And so the things that you can share, the things that you can say, and the things that you believe about issues are relevant and important, and they're the things that influence. They really do influence the decisions that lawmakers make. The issue is that not very many people like you and me participate in that process. That's why it's so important for AHA to have volunteers and advocates that are engaged in our legislative and advocacy process across the state. So what do our volunteers do? They bring their sphere of influence and partner with us to leverage that influence to achieve results. So we have a network of volunteers across the state who we call on to call their legislator. We call on them to write letters to the editor. We call on them to tweet, to post, to share their story, and to be communicative about these issues that we also passionately believe in and are seeking, change in the state. So a few of our issues. We have a lot. And I'm just going to kind of go through some of the ones that I'm working on currently. There's a lot more than what I'm going to, mention here today, but I'd love to follow up with anybody who, wants to know more about any of these things. We're looking at telecommunicator CPR, and hopefully we'll be making some changes to that policy through regulatory change here in the next quarter or so. But TCPR would require that all 911 telecommunicators that provide dispatch for emergency medical conditions be trained in the delivery of high-quality telecommunicator CPR. So high quality TCPR is the delivery by trained 911 telecommunicators of high quality CPR instructions for acute events requiring CPR, including but not limited to out of hospital cardiac arrest. So before I started working on this policy, I just assumed that if I called 911 because somebody, in my life was not breathing, that they would be able to talk me through how to conduct CPR. Before coming to Heart, that wasn't a training that I'd ever taken. And I was shocked to find out that that only happens in about 3% of your 911 calls. All, medical emergency dispatch are trained in CPR, but they're not trained to talk somebody through CPR on the phone. And so that's what we're trying to require as part of, training standards for Mississippi. The other issue that we're looking at is water access in schools. And so this policy is to ensure that no cost clean water is accessible during the school day and extended hours while children are in programming in school buildings. So this would mean we'd enact a statewide policy requiring that portable water bottles be available at no cost to students throughout the school day. It would be policies that increase access to drinking fountains in schools to encourage consumption throughout the school day and during school-based activities. It would be policies to ensure that all newly constructed schools and schools undergoing major renovations have water bottle refilling stations. So there's a lot of research out there that shows that young people who have access to a water bottle refilling station are 3 times more likely to drink water at lunch than kids who just have access to a regular water fountain. We've worked with some school nurses who have shared with us that more often than not, the kids that come to them for headaches, stomach aches, that they're having difficulty focusing, whatever the condition is that they're, commonly seeing, that the first question they're asking students is, when the last time you drank water? And most students are, responding and saying it's been days since they had water. They're drinking sodas, they're drinking juice, they're drinking chocolate milk, but they're not drinking water. And there's so many positive health outcomes that come from just being hydrated, and this, access to clean drinking water, in my opinion, is something that every child should have access to. And I know, for if you think about our students in Jackson Public Schools, for example, I don't know if any of you live in Jackson or have lived in Jackson, but when we lived in Jackson, we didn't drink the water out of the faucet. We bought water. The water, there was always boil water notices. It never felt like, I could just drink tap water and it'd be fine. We were constantly finding ways to have filtered water. And a lot of students don't have the luxury, or people don't have the luxury of being able to, buy filtered water. So they're buying cheap, sugary beverages instead. And if we want to guarantee that young people have access to, this life-sustaining substance, it's got to be in schools. And so we're hoping next year to pass some legislation that would require new construction and major renovations on school campuses to put in water bottle refilling stations, and to talk through what a policy would look like that would allow students to carry water bottles in schools across Mississippi. One of the other policies we're looking at moving into this year are SNAP incentive programs, and so that would be to fund targeted projects for the Supplemental Nutrition Assistance Program, or SNAP, authorize retailer incentive programs for SNAP benefits when used on fruits and vegetables. So through the SNAP program, you can, so say I go to the grocery store and I buy, some fresh fruits and vegetables. There's a federal match program that would allow the purchase of those fresh fruits and vegetables to put more money, or it's that incentive, right? Put more money back on my account or my card. And so in Mississippi, it is a federal program through the USDA. We have a grantee in Mississippi that is responsible for those, it's called double up food bucks, but those double up programs, they've mostly been used in farmers markets, but they're working to get into retailers so that when people go to the grocery store and they, use their EBT card on fresh fruits and vegetables, that it's an incentive, that there's this financial incentive for them to eat healthier, right? What Mississippi doesn't do as a state is we don't fund or appropriate funds for that program. And so what we would like to see is the state of Mississippi saying, we value healthy eating, we value fresh fruits and vegetables, and we want SNAP beneficiaries to be healthy. And so we're going to appropriate $250,000 into a state fund that would go to helping match those double up food bucks. So that's one thing we're looking at. Another issue we're looking at in light of COVID-19 is Medicaid expansion. And I know it's a very, controversial issue. It's very political. The American Heart Association really doesn't see it that way. We believe that all people should have access to care, and we know from science and research that when you have access to medical care, you are less likely to experience a heart attack. You're less likely to have chronic health conditions. It just, access to care just generally makes us healthier people. And in Mississippi, because we didn't expand Medicaid, there's somewhere around 300,000 Mississippians who aren't eligible for any type of health insurance in the state. And those tend to be working class folks who are more prone to chronic health conditions. Mississippi is very rural. We have an issue with the access to care anyways, right? If you live in rural communities, you might have to drive 45 minutes to get to a hospital, or you might have to drive farther than that just to get to a doctor. And access to care can kind of bridge that gap, right? So we call it whatever you want. We can call it Medicaid expansion. We can call it, covering the gap. We can call it Medicaid reform. Whatever it is, we believe that people should have access to health care. And so the policy is to assure that the Medicaid program provides access to health care for adults earning up to 138% of the federal poverty level. And really what this looks at is we're talking about people with low incomes, low wage jobs with chronic health conditions. They're the ones who face more barriers to healthcare, many of whom are people of color and who live in rural areas. They're going to be hit, and we know they're hit, right, the hardest from the coronavirus. They're the ones that are dying. They're going to be more sick. They're going to need most likely going to need that ICU care that we're hearing so much about on the news. But they're also the ones that are most likely to receive bills that they can't afford. They're going to lose their jobs because they're out of work and they don't have the same kind of employment security that I do or that your teacher does. And they're going to lose their jobs. 51% of Mississippians live in rural areas, and we have some of the highest rates of chronic illness, such as heart disease and diabetes in the nation. And these rates are even higher among African Americans. So expanding Medicaid right now in Mississippi is one of the best ways to level the playing field and give everyone a fair shot in getting through this public health crisis to come. It's a way that we can, going back to our 2030 goals, right? It's a way that we can address that life expectancy. Equitable access to healthy, successful lives means access to care. And right now, Medicaid reform is the vehicle that we have to do that. Is it perfect? Probably not. Could we do it better? Definitely. But we have to work with the systems that we have at the moment. And right now, what we have is Medicaid expansion. And it's important for the livelihood of the state. All right, so those are just some of the policies we're working on. Like I said, so many more beyond that. We're looking at tobacco taxes, we're looking at vaping. We look at STEMI stroke registries. We're looking at early childhood education, Head Start funding. I mean, it's a wealth of policy issues. So if you want to know more about the policy areas that we cover, or if you're interested in any of the things that I mentioned just now, I'd love to talk to you about them, and would love to get you involved in how you can advocate. And so here's an example of how we do that, or how you can do that. So the first is to take the conversation online, right? And that's like the easiest thing for all of y'all young people today, right? You can, now more than ever, we can advocate at the touch of a button, right? Like you literally have advocacy in the palm of your hand. And so there's no excuses to be engaged. Elected officials use social media. They use it to gauge public opinion and to share opinions and activities. If you're not following your elected officials, do it on Twitter. Follow them on social media. Some of them have Instagram and other platforms, which is just fun and interesting to watch. But I would recommend Facebook and Twitter if you're not looking for a laugh. A report by the Congressional Management Foundation says that nearly 2/3 of congressional staff surveyed, and 64% of folks think that Facebook is an important way to understand constituents' views, and nearly 3/4, or 74%, think it's important for communicating their members' views. So our elected officials are using it, you're using it, connect with them. Like I said, like and follow your local, state, and federal lawmakers, as well as any key and local national news outlets, so that you can be a part of a dialogue. If you like your state legislators, you'll be able to tag them, which is important as well. So you can, I don't have to tell you how to use social media, but figure out ways that you can be engaged in the things that you use every day, right? Make sure that you like the American Heart Association, the Jackson metro area, so that you can follow us and follow what we're doing, and tag us in any posts that you might be sharing, or tweets you might have as well. So the other way to be engaged is to take the conversation offline, which I know can be scary for your millennials and those that are younger than us, because you have to talk face-to-face with folks. But this is a really important way to engage in advocacy as well. So think about, what are those issues that are important to you? How can you share your story, right? Like today I've shared a handful of stories about me and my experiences leading into advocacy, but also my experiences in advocacy and the work that I've done. And those are super relevant, and they help create a context for a conversation. And it connects you to other people in a really personal way. So it's a good way to share your story, and it's a good way to educate others. So we would love for you to do that by being a part of our network. So I know you all have your phones out, because you're probably only halfway listening to me right now, which is okay. But if you would text HEART to 46839 to join our You're the Cure network. So earlier I mentioned that we have a network across the state of folks that are advocates who we can call on to share their story, to tweet, to post, to write a letter to editor, to send an email, whatever it is. We don't bombard you with content. You maybe get an email, at the most monthly. You get a little bit more contact from us during the legislative session. But I would love for more young people to be involved in our advocacy network. We're really trying to bring a new generation into the American Heart Association in Mississippi. I'd love that to be through advocacy. So please text HEART to 46839 and join our network, so that you can stay engaged in what we're doing. Let's see, and this is let's see if I can make it bigger. All right, this is my name, my email address, and that's my work phone. Best way to get in touch with me is to shoot me an email. Please email me with questions. I'd love to hear from you. I'd love to hear what you're interested in. and ways that we can connect. Good luck in all of your endeavors. I think this is a senior class, so wishing y'all success in all the things that you do. And remember, as you move into your careers in public health, remember that social determinants of health matter. Remember that the places that people come from and the environments they live in and the experiences they have really shape their health outcomes, and they make it either easier or harder for them to be healthy and successful. And so it's our jobs to do what we can to reduce those barriers and to bridge the gap between an individual and the healthy life that they deserve. Thanks for letting me speak to you today. And I look forward to someday, hopefully, running into some of you in person and not through video.